Hello, everyone. This video is Longus capitis and Longus coli. So let's get started. These muscles are on page 260 in your book. Longus capitis and Longus coli are opposite the erector spinae group. They are directly across from them on the vertebrae. So the erector spinae are on the posterior vertebrae. Longus capitis and Longus coli are on the anterior vertebrae. Now, this is a very strange view. As you can see, you probably are not entirely sure what you're looking at. Basically, they've cut off the face, and you're looking at C1 and C2 here from an anterior view. So Longus capitis and Longus coli are deep neck flexors. That's what they do. I mean, they are in between the trachea and the vertebrae, so you can access them. However, you are going to have to move the trachea out of the way a little bit to get to the anterior vertebrae. These have a design similar to the erector spinae group, where they kind of interweave as they work their way up the neck. And so this one should look very familiar because this is sort of the same kind of pattern as the spinalis muscle on the opposite side. So Longus capitis, of course, is actually going to attach to the skull, hence the word capitis. And then Longus coli is going to just be in the anterior neck. So capitis originates on the transverse processes of C3 through C6. Notice it doesn't say cervical vertebrae 3 through cervical vertebrae 6. They actually abbreviated it for you this time. How lovely. TP is C3 through 6. And then inserts on the inferior surface of the occiput. So we are inferior surface of the occiput. So we're way, way down here, way back here. We're looking at the occiput. We're like down in here, actually over here. Sorry. We're right in here. So there's no way we're going to be able to palpate that. Pardon me. So Longus capitis and Longus coli are deep neck flexors, as I mentioned. So that's their bilateral action for both. Unilaterally, they can laterally flex the head and neck, and they can rotate the head and neck to the same side. So they're ipsilateral rotators. Rotate the head and neck to the same side. Okay. Again, there's basically, I don't want to say antagonists to the erector spinae group, because they can also laterally flex, and that's something that the erector spinae group can do as well, and rotate. The erector spinae group can do that, so they aren't direct antagonists, but the erector spinae group, of course, extends. Longus capitis and Longus coli can flex. Okay. All right, so looking at Longus coli then, origin is the bodies. See, these are the vertebral bodies here. That's what these little black marks indicate, of C5 through T3. And then the transverse processes of C3 through C5. So you've got a couple little transverse process attachments here. But from the anterior, again, these are anterior portions of the transverse processes and bodies of the vertebrae. The insertion then is going to be the tubercle on the anterior arch of the atlas. So it's that little anterior part here that holds the dens. And the bodies of the axis, C3 and C4, transverse processes of C5 and 6. Okay, so kind of random, all over the place there. But you see where they are. They have, it almost looks like they're taped on. Okay. And again, the actions are the same for both. They are synergists and they're in the same spot. So that makes sense. So let's take a look at these on the visible body. Kind of a better view. You can see them both in there at once. And look, the skull is still there. So if we maybe hide the skull, hide that for a second. Oh, wow, the teeth are still there. That is bizarre. I expected it to take the whole lower jaw. Oh no, I'd have to individually get rid of each tooth. Okay, I'm not doing that. But anyway, that is super weird. You can see the hyoid bone here. And then these are going to be longus capitis right there. And longus coli right there. Okay, but anyway, you see how they actually attach to the bodies of the vertebrae, but along the ligamentum flavum here. Do you remember ligament, or not the ligamentum flavum? I'm sorry, that's interior. This one's the anterior longitudinal ligament. It runs the entire length of the vertebrae and holds them all together on the anterior surface. The ligamentum flavum is inside the vertebral column. So there you go. I got rid of the jaw and the teeth are still there. I just wanted to see maybe if I turn them like this. Kind of. I wanted you to see all the way up to C1 and 2, but I don't think that's going to happen. Not in this weird view. Well, kind of like that. I guess you could see them like that. Anyway, what I brought up here was vertebral column spinal flexors, and you see quadratus lumborum they have listed here as well, which I would argue with, but whatever. Okay, so longus capitis and longus coli, that's it for those. The next video would be on muscles of facial expression. We are not going to go over origins and insertions for all of the muscles of facial expression. We are only going to talk about where they are and what they do. Okay, so stay tuned.